Good afternoon. My name is Pranay Soni. I'm one of the skull-based surgeons at Cleveland Clinic. Today, I have the honor to introduce a remarkable young man named Jordan. Living with NF2-related schwannomatosis, he has faced more challenges than many of us can even imagine. Despite these obstacles, his resilience stands out. I've had the privilege of caring for him for the past 4 years, and he has also been under the care of Dr. Lobus, one of our neuro-oncologists. I know you'll find his story as inspiring as I do. Jordan, thank you so much for joining us today.
Of course. Thanks for having me.
And for the audience, Jordan hasn't seen or heard these questions. So, Jordan, if there's anything you want to pass on or don't want to answer, feel free to let me know.
Will do.
Jordan, I wanted to start by letting the audience get to know you a little bit. Can you tell us a little bit about yourself?
I'll try to keep it short. I am about to turn 33 this year. I lost, all these symptoms presented in the last 7-8 years or so. Prior to these symptoms presenting, I was attending college, had just received my first job offer in working with juveniles in terms of juvenile probation at one of the detention centers in Erie, PA. I was interested in a career in law enforcement in general. I was trying to decide between local, state, federal law enforcement. And when all these symptoms presented, it was, world-ending in a lot of ways. Not only with the vision loss, that was one thing, but also the balance as well that comes with schwannomatosis, I think is what we're referring to it now. Right. And all those symptoms presenting really, ended and changed everything for me all at once. And it was a very quick presentation. I lost my vision, I would say, in about 2 weeks from the first fading. I had been struggling with balance issues prior, but due to my martial arts training and my relative good health prior to all the atrophy and other things that I suffered later on, I was able to kind of work through those balance issues, but they really came to a head all of a sudden. And then once that happened, I lost my job offer, lost my future career, and, as I said before, lost everything. And it took me quite a while to adapt and hopefully thrive. We'll see how that goes. But yeah, that's, my story in a nutshell, essentially.
Yeah, thank you so much for sharing that. Now, you mentioned the symptoms were kind of the first presentation that anything was going on. Mm-hmm. When were you actually diagnosed with NF2?
As an infant.
And obviously as an infant, you didn't know what that meant. At what point do you think you understood what NF2 meant to you?
What it meant to me is different than what it actually is. I want to make that distinction clear. What I learned about NF2 schwannomatosis essentially was that it's a bad thing. My first experiences with schwannomatosis were my mother crying on a couch, praying to God that I wouldn't be presented with these symptoms in the same way that my biological father had been. And then, of course, there was my biological father. And he did not adapt well, let's say, to NF2. He became very embittered, right? And he, took that bitterness out on his family. My mother, when they were dating, thankfully never married. And then his bitterness, I would credit to a certain degree with my denial, because I did not want to become like him. And in my young mind, especially at that age, as I said, you kind of associate all the bad stuff with the word NF2, or the phrase NF2 rather. And so it just became something I would just avoid, never think about, this could happen to me, but it probably won't. I'll probably be fine. I'll just keep drinking water and working out and, continue developing my six pack and it'll be fine, right? unfortunately, that's not how brain masses work, right?
Now, at what point would you say you started to understand what NF2 really is?
Ironically, not until after I had gone through all the experiences I had. Once my symptoms all presented at once, it was not so much a wake up call, but kind of a blaring alarm that kind of wakes you out of bed and like makes you disoriented, right? Like I didn't know what to do, where to go, who to talk to. And then it was only through the slow process of, thankfully working with people like you and Dr. Labus, that I was able to discover that NF2. And again, I wouldn't wish this on my worst enemy, but it is something that can be lived with, especially now that medical advancements have been made. Because I think part of the reason why my father was so bitter is that it took so much from him, and it's taken so much from me as well. But in his time, it wasn't something that could be so easily lived with. There wasn't as much understanding. There weren't as many accommodations for people with disabilities and things like that, things that NF2 and schwannomatosis will lead to eventually, including deafness, problems balancing, things like that. So now that there are more accommodations and there are more people who understand what the diagnosis means and doesn't mean, it's easier to live in that kind of world, if that makes sense. So I would say I learned what it actually is probably when I was 26, 27, when I came to the realization that it's something that I can live with and maybe not overcome, but adapt to, if that makes sense.
Yeah, absolutely. And I remember you mentioning that you have a cousin who also has NF2 and that you had some advice for him. Can you tell us a little bit about that?
Don't leave it too long to go to a doctor, go to a medical professional. He, like me, heard for so long that you had this diagnosis. You really should go to a doctor. And it's eventually something that you just come to, denial isn't the right word, but you become almost defensive, if that makes sense. You don't want other people to know because you know how they're going to react. Oh, you have cancer, or oh, you really need to go to a doctor. And eventually you just kind of want to, push it all away and just quote unquote be normal, whatever it is that means, right? And so my advice would be to ignore your own insecurities to a certain extent and seek out medical treatment, because especially, again, with those medical advances, it's something that we can live with and hopefully maybe even something that we can fix in the future, at least the things that are wrong with me now, I would say.
Yeah, absolutely. And, we've heard about some of that today, and we'll still have some more
I'm excited
to go. So now you've worked with many physicians across different specialties over the past several years. What are some of the things that you wish that all providers would keep in mind when they're caring for someone like you, someone who has NF2?
That's a really good question. Understand that, well, I can only speak from my experience, Dr. Sony. So I would say if I could give all interdisciplinary doctors advice, is try to remember that your patients are scared. And so whatever way that they're reacting, whether that's angrily or denial or, despair, whatever, fear isn't something that you can cure, but it is something that you can reassure, if that makes sense. So you can make it very clear to another person that their life will continue. It will change, but it is something that they can adapt to, and to, I guess, have a list of like accommodations that could be made, like who can train you if you're losing your hearing to use your phone differently, if that makes sense.
Yeah. And you mentioned that's a good segue, because that's some of what you do. And you mentioned that your initial aspirations were in law enforcement. And I remember when I first met, you had continued some of the work in that field. Can you tell us about that, how it's changed over time and what you do now?
Well, what I do now is prepare for the certification exam in order to then actually start receiving paychecks, right? But to answer your question as simply as possible, yes, my initial career was in law enforcement, and my initial aspiration after losing everything was to continue working in that field as much as I could in becoming a dispatcher, right? But we quickly realized, when I say we, I mean me and the various state counselors working through Ohio BVR and other vocational rehabilitation services, all came to the conclusion that that doesn't really work for me, as I only have one ear left, no vision. It's kind of hard to work with the computer while also listening to having someone have an emergency over the phone, right? It's not workable. So then I had the idea, well, why don't I work in mental health? Because, I think I have a pretty good frame of mind, right? I have a pretty good perspective on life. I've been through a lot, so I have a lot of experiences that I could share with others, which is what I'm doing today. So I thought mental health, working as a therapist or as a psychologist or psychiatrist, but that requires a degree I don't have, which the state didn't really want to pay for. So, that's understandable to an extent. And so now I am preparing to pass a certification exam that will allow me to remotely teach people who are experiencing some form of visual impairment, whether that be blindness or just, fading vision or whatever, to use a program called Job Access with Speech, or JAWS, in order to still be able to use a computer. So it could be anyone from an older person who is working in an office job who's slowly losing their vision and needs a way to be able to scan documents and, type in Microsoft Word and things like that. JAWS can help with that. Or it can help a fully blind person straight up explore the internet in all of its insane glory. So that is what I do now, and I'm hoping to use the skills and the paychecks and the mindset from this job that I am preparing for in order to achieve that ultimate ambition that I still have, which is to work in mental health, because I think I'd be good at it.
Yeah, I think so too. And the motivation that you have every day is an inspiration. Now, with everything you've been through, has your definition of a good day changed over time?
Yes and no. Yes, especially initially when I was first adapting, right? Because there was a lot more fluctuation in terms of what I was able to accomplish depending on what day it was. Like if I was just staying at home and I wasn't going to go to my JAWS training, because at the time I was figuring out how to use JAWS for the first time. If I wasn't going to JAWS training, it was a good day because it meant that I could do everything myself, right? And then once I started adapting more and more and becoming increasingly independent, and just, for the viewers at home, I started off having to be bathed by my mother, which is not an experience I would recommend for anyone. And now I do my own cleaning, I do my own cooking, and I do my own finances, all independently, which is a major sea change from where I was just, 5 years ago. And so a good day would be one in which I was able to do everything I needed to accomplish for that day independently. And I'm better at having good days, if that makes sense. I'm much more independent than I once was. There's still a lot of things I need help with, like you putting a microphone in my hand, for example, because I don't know where it is. But even on the days where I need assistance, having a different perspective, a different frame of mind means that it is no longer a bad day when I need help, if that makes sense.
Yeah, absolutely. And as we wrap up, I just wanted to ask, what have been the best resources that somebody who has vision trouble or hearing impairment can go to, or somebody who has balance trouble? What have been the resources that have been most helpful for you?
Definitely start with Ohio BVR or the Bureau of Vocational Rehabilitation. From there, they will assign you to one of their other programs. Like I worked through Ohio BVR, which assigned me to Opportunities for Ohioans with Disabilities, OOD, and then a counselor in one of those various programs will then determine after speaking with you and viewing all your medical records and all those other things, kind of determine what will work best for you, and then refer you to various services throughout Ohio. We have really good, well, not really, really good, but middle of the road, pretty good accessibility to various services like the Cleveland Sight Center was where I started, where they would determine what kind of technologies, what kind of adaptations would be best for me, that being a phone that talks to me, that, teaching me how to use a phone that talks to me, teaching me how to use a computer that talks to me. But that might not work for everyone. So really start with your state vocational rehabilitation agency, whatever that may be.
Yeah, thank you so much for sharing that. And
Of course.
I wish we could keep talking. We have so much more we could talk about, but we're out of time. So thank you so much again for joining us and
course.
sharing your story.
Thank you for having me, and I hope to come back another time.
Thank you.